various UN health bodies that opiate substitution therapy should be the frontline treatment for heroin addiction. It reduces street heroin use. It reduces risky injecting behaviours associated with the transmission of HIV and other bloodborne viruses. It reduces drug-related death and drug-related criminal activity, and should be the sort of first point of call to stabilise what's often quite a chaotic lifestyle that heroin and other street drug users have, and to move them to a point where they can recover and be part of their local community again.
In terms of substitution therapy here in the UK, is this a really common part of drug treatment programs here in the UK?
Yep, off the top of my head, I think it's about 150,000 thereabouts on opiate substitution therapy in England. We know from studies that we've done where we've matched kind of police records and treatment data, we know that once people come into treatment, it reduces their drug-related criminal activity by about a half. They show good progress in reducing their illicit drug use, begin to start being able to look after their families again, and so on and so forth. I mean, the list of benefits that it brings is quite long, but certainly on bloodborne virus, it's the kind of frontline approach, if you like, public health approach to reducing the transmission of bloodborne virus amongst injecting drug users.
Just a quick reminder to our listeners that you're listening to The Voice of Russia with me, Scott Craig, and today I'm discussing drug treatment programs and HIV prevention in the UK and Russia with my guests Alex Fleming, Brendan Hanlon and Darya Khalturina. Brendan Hanlon, let me come to you. In terms of, we're talking about drug substitution therapies here, from your organisation's perspective, is there any evidence that suggests that drug substitution is an effective way of combating HIV transmission?
Yes, there is. For example, on our website we carry the results of a report, which is an American report, which looked to see the effects of drug substitution therapy. And after 18, this was in Philadelphia, after 18 months, 3.5% of those receiving methadone became infected with HIV, in contrast to 22% of the people not on therapy who went on to get HIV. So there's quite a big difference there. There's also again, to refer back to the World Health Organization again, what WHO did was review lots of global studies. Its conclusion was that substitution treatment is, quote, a critical component of HIV prevention policy, and it had quite a large contribution towards HIV infection rates. So the evidence is there around substitution therapy. It just takes political will in order to take it forward, which at the moment obviously doesn't exist at all in Russia.
I want to talk about access to drug treatment programs. Darya Khalturina, how easy or difficult is it, in your view, in Russia for people who have substance abuse problems to actually get treatment for those issues?
But it's not very attractive for drug users, and I'm not sure how effective it is, because what's available is the governmental network of narcological clinics, and I'm not sure how they really treat the drug users, but the drug users stay there for a couple months if they want to do so, and they are given some medicines. I think mostly kind of sedative medicines, or some medicines which reduce the will to inject drugs. And there is a general very large skepticism among specialists, among experts about the effectiveness of this prevalence of this treatment. Some people say that it is about 7% of 1 year remission, which means that 7% of those who were in those clinics stay out of drugs for a year, which is not very impressive, you know.
I want to ask you, we're nearly out of time, but I also want to ask you about the case of Albert Sajin, who was head of a Russian rehabilitation center in Novosibirsk against drugs. He was actually beaten up last week, but the main point is his methods. His methods are quite controversial. He essentially forces people into treatment against their will. Do you think such treatments are ethical or can they be effective?
Again, nobody really monitored that. And in terms of effectiveness, I'm not really sure. There is another rehabilitation program in Ekaterinburg which uses kind of more greater, people who are sort of agree, but in general they are accused of the same. So basically, I don't know if it's ethical or unethical, but I think it is done out of desperation.
You're listening to The Voice of Russia with me, Scott Craig, and today I'm discussing drug treatment programs and HIV prevention in the UK and Russia with my guests Alex Fleming, Brendan Hanlon and Darya Khalturina. Alex Fleming, on the question of access to treatment and treatment methods, I presume that we're not talking about forcing people in the UK into treatment against their will. Access to treatment, really, what is the situation like?
It's been a success story, if you like, for drug treatment services in England in the last 10 years. These days, drug treatment is available to everyone who needs it, free at the point of delivery. 96% of those people get the treatment they need within 3 weeks of asking. One of the things that's happened quite successfully in England in the last 10 years is that the criminal justice system is kind of configured so that if you come in and you've committed what the police consider to be a drug-related crime, there are routes into treatment system rather than kind of incarcerating those people and putting them into prison. So there's a kind of mix of self-referral, people asking for help from their GPs, and kind of turning up in the criminal justice system and getting rooted into treatment. The success rates, if you like, for all of those different types of people are the same. So although perhaps the people who come into the police cells and are rooted into treatment, they might not voluntarily go into treatment. What we found is that actually their outcomes are just as positive as the rest of the system.
We are living in an age of financial austerity in the UK. Do you have any concerns at all that any of the programs that your organisation, the National Treatment Agency for Substance Misuse, provides might be under threat?
I think everyone's budgets are being stretched and are under question. The government, the most recent government, came out quite strongly in support of prison and community drug treatment. So the central government's kind of allocation is about £600 million in England every year. That's remained largely static. So we were quite pleased that central government understood that the issue was serious enough and kind of put their money where their mouth is. So looking forward, drug treatment will be commissioned by local authorities in a new kind of public health landscape from April 2013. And I think in each local authority area in England, we'd have to have those conversations with kind of decision makers in each local community to say, yes, we want to continue to invest in these services. But we would certainly point to evidence that says that drug treatment delivers value for money for the public, keeps communities safe. For every £1 invested, £2.50 we get in crime and health savings. So we think it's a sensible use of public money, and we've got quite a lot of good evidence to make those cases nationally and in local communities.
Brendan Hanlon, HIV rates in general in the UK are increasing. It's a very complex issue, I'm sure, but in essence, why, in your view, is that happening? We've had 20 plus years of safer sex messages and so on.
Well, primarily that there hasn't been any major prevention campaign in the UK for 30 years since AIDS first became an issue. In terms of education, it's not taught in schools. There's lots of talk about safe sex messages, which aren't really carried into schools and the like. And so essentially, there's a lack of broad education around HIV. There's a lot of ignorance still out there about it. Whereas some groups are acting up, others aren't. And so, what I would say on behalf of Avert is that what we'd really like to see is a greater prevention campaign being held, so people can become more educated to show that this is still a disease which is you don't have to, which can be prevented rather.
I'm afraid we're out of time there. We must leave it. My thanks today to my guests, Alex Fleming, Brendan Hanlon and Darya Khalturina. You've been listening to Scott Craig on The Voice of Russia. Stay with us.